Good evening to each of you who have joined us for this important discussion made possible through the BDO StreamYard platform and Facebook Live. I am Dr. Randall Morgan Jr., and I will be your host and moderator for this evening. I also serve as the president and CEO of the W. Montague Cobb Health Institute. The Cobb Institute was founded in December of 2004 at Howard University by the National Medical Association to pursue solutions to health disparities through scholarly discovery of key drivers of these disparities and the data collection necessary to support these solutions. Since 2008, the Institute has been a 501c3 nonprofit organization separate from the National Medical Association, but remains a strategic partner of the NMA through most of our programs and initiatives. Our host on this platform this evening is blackdoctor.org, an important organization that also is 20 years old and currently is the world's largest and most comprehensive online health resource specifically targeted to African Americans and their collective culture. The Cobb Institute and the blackdoctor.org have collaborated to produce this webinar series for almost 2 years. The leadership of the National Medical Association has been a part of the history of Detroit as well. The Detroit Medical Society has been prominent in the leadership of all the academic institutions in Detroit and surrounding communities of Michigan. The University of Michigan, Wayne State University, and Henry Ford Health Systems have been responsible for medical educations for hundreds, if not thousands, of Black physicians and research scientists. Finally, the Charles Wright Museum of Black History was established by and named for a distinguished graduate of the University of Michigan who wrote the first comprehensive history of Blacks in medicine, and especially Black-owned and administered hospitals. This evening, we will learn much more about the legacy of Blacks in medicine in Detroit and appreciate the crucial contributions to the survival and well-being of our important organizations in our community. We welcome two distinguished physicians who are both residents and physician leaders of the greater Detroit community. We're thrilled to have them both as speakers this evening, as participants within the current healthcare system in Detroit, but also they have the knowledge to discuss the topic for our discussion this evening, the importance of contributions of members of the Detroit Medical Society and the National Medical Association to the history of medicine in Detroit and the impact upon the society of this important city in the United States of America. They both have contributed to the improvement of healthcare and healthcare knowledge for all patients in the Detroit community who have been fortunate enough to have them as their physicians. They are also experts in the history of the Detroit community and will share specifics about the current status of the city of Detroit and its health status. Their combined perspectives will be most informative. I am honored to introduce our speakers this evening, Dr. Melanie Hanna Johnson. Dr. Melanie Hanna Johnson is Associate Professor of Clinical Medicine at Wayne State University School of Medicine in the Department of Internal Medicine. She earned her Bachelor of Science from the University of Michigan, her MD from the Wayne State University School of Medicine, and completed her internship and residency at St. Joseph Mercy Hospital in Pontiac, Michigan. She also holds a Master's in Health Service Administration from the University of Michigan. A board-certified internist with Wayne Health, she has taught leadership roles such as Associate Program Director and Chair of the Internal Medicine Search Oversight Committee. At Wayne State University School of Medicine, she teaches first-year medical students in the P4 course. Dr. Hanna Johnson has served in key roles within the National Medical Association and is currently the Speaker of the House of Delegates. A fellow of the American College of Physicians, she actively mentors students through the Biomedical Career Advancement Program. Dr. Lonnie Joe is a pulmonologist at Ascension Providence Hospital in Southfield, Michigan. with a distinguished career in patient care and physician advocacy. He serves on multiple boards, including the State Medical Society, University of Michigan Medical Alumni Association, the National Medical Association, and the Greater Detroit Health Council. He is also a member of the Novo Nordisk Advisory Board and Southfield Institutional Review Board. The longest serving president of the Detroit Medical Society, Dr. Joe was named the Physician of the Year by the National Medical Association in 2008 and later served as Secretary of its House of Delegates. A graduate of the University of Michigan Medical School, he completed his internal medicine residency at Providence Hospital, a pulmonary fellowship, and advanced his expertise through the Johns Hopkins Business of Medicine program. With that introduction, welcome Drs. Joe and Hannah Johnson.
Thank you, Dr. Morgan, and thank all of your team and staff for putting this program together. This is certainly well done, something that we need to do to archive and to capture this history. When you asked me to do this, I started looking at different things around Detroit that stood out. And even though I've lived here all my life, it's amazing how much that I learned just by paying attention to some of the things around us. Programs like this certainly can help us capture that kind of history. I'm also happy to have my friend and colleague, Dr. Melanie Hannah Johnson, who is the current Speaker of the House of Delegates for the National Medical Association, as you said, Dr. Morgan, joining us on this program this evening. Melanie, thank you so much. We know that you have a wealth of knowledge being here all your life. And one thing I just learned, I did not realize that you went to undergraduate school at University of Michigan.
Yes, sir. It's an honor to be here with this distinguished team. And frankly, I never thought I'd be sitting in this place with one of my mentors, Dr. Lonnie Joe, and one of the leaders in the National Medical Association, Dr. Randall Morgan. So it is indeed an honor.
And just before we get started in this discussion, which I'm sure is going to be chock full of tidbits, Dr. Morgan, on a personal note, thank you for all that you do in terms of the Cobb Institute and the National Medical Association, all of the hard work we know that goes into it behind the scenes that a lot of times that we never see. We just wanted to acknowledge that and thank you as you continue this journey in terms of expressing what Black physicians can do in this arena, especially in this country. When we look at healthcare in Detroit, I think a starting point would be, Melanie, for us to go back to around the turn of the 19th century when Henry Ford announced that he was going to pay people $5 a day to work in the plants here in the city. And a lot of folks from the South, including my relatives, made their way to Detroit to make $5 a day to work in the automobile plants. That is a turning point for the city of Detroit, because on the heels of that, a lot of Black people, including Black physicians later on, developed a middle class that was one of a kind in this country.
Yes, absolutely. Dr. Joe, it's so fascinating to look at where people from the Deep South, my family included, ended up. Detroit was one of the hubs of the Great Migration, and many of us benefited from that journey. If you wanted to work in the automobile plants, you could. Having a focus on education wasn't beyond the reach, as long as you were willing to study, because of initiatives that came through the programs of Franklin Delano Roosevelt. So I'm a product of many of those initiatives, and so are my relatives.
Yeah, we can probably look back and name a lot of family members who took advantage of that if we look far enough. But here again, with that happening, we saw that commerce, business begin to flourish here in the city of Detroit. And as segregation was the theme of the day, Black people lived together, no matter what the status, no matter what the educational designation was or where you worked. where you even went to church. Black people lived in the same neighborhoods, and a very prominent, popular area grew out of the Lower East Side of Detroit, which Wayne State's campus is partly on right now, called Black Bottom. And in Black Bottom, there was a roaring community run and owned by African Americans, Black factories, Black businesses, what we would call 4- and 5-star hotels, entertainment venues where people of the day would come from all over the country and love to arrive in Detroit for entertainment, which has continued until now. But back in those days, it was a destination city in terms of everything that surrounded about life and raising a family and experiencing the American dream.
Absolutely. And then we think about places like Idlewild, which is where a lot of our people congregated to have entertainment, and some of the highest quality entertainment came to that venue, not far from Detroit. Paradise Alley, another part of near the Black Bottom. These were places that allowed us to be free and to put on our sequins and not be constrained by all of the restraints of the Deep South, the Jim Crow South. So we came together, and I remember when I was growing up, we had doctors in our community, we had working class people in our community, and we all lived together. I know you'll be talking a bit about some of those leaders who not only helped to mentor young people like me, like Dr. Natalia Tanner, but made a difference to the entire Black community and to many young people that by modeling the behavior. I remember when Dr. Tanner took me once with her daughters, Anita and Sheila, skiing. And, you know, that exposed me to something that I had never done before. And that's basically how many Black physicians, I remember going over to their house for breakfast one morning. That's how we got exposed to something a little different than we were used to, but it also exposed us to the possibilities for us.
You know, and in spite of all of the difficulties, the Black community continued to grow and to thrive. The economics produced a environment that also began to attract Black physicians. Detroit became a destination city for Black physicians, particularly in those days with people graduating from Howard and Meharry. They would go to Homer G. Phillips Hospital in St. Louis and leave Homer G. Phillips and come to Detroit to practice because the ground was fertile and the opportunities were better here than most cities, especially in the North. And out of that birth became a robust environment for Black physicians to practice medicine. I ran across a book at the local library, the main branch of the library, Dr. Johnson, downtown, called Colored Detroit, 1925. There's only one copy of it in existence. They guard it like it's gold, and you have to be supervised you can't check it out. You can only sit there and look in it. But it became an expose of what was happening in the city of Detroit. And when I looked at the healthcare section, it was amazing at the number of Black physicians that were here, the number of so-called allied health professions that existed in terms of pharmacies and the dentist roster. It was just a continuous list of names and addresses, locations, almost like a yellow pages for Black healthcare professionals in Detroit. And I'm saying, wow, sometimes I think I would have a hard time finding that many folks today looking at how vibrant the healthcare community was then. But even then, with a depression looming, Detroit remained a place to come for people to actually practice medicine. And out of that grew a large volume of African-American hospitals, not to mention in 1918, with this being a destination area, the Detroit Medical Society, which started off as the Allied Medical Society, later on became the Detroit Medical Society, The first branch of the National Medical Association here in Michigan started on the backs of these doctors. And we have some pictures around at our headquarters right now that show a lot of the members who were in the Detroit Medical Society at this time. Some of them are grandfathers of a lot of the politicians that we have around town now. But here again, it was an environment and a camaraderie that made people what they were in terms of being successful professionals.
Yes, sir. And when you say that, it reminds me of the fact that I need to get back down to the library, our main library, which is a jewel and a source of tremendous information, the historical society room. But that what you just said reminded me of Dr. Lionel Swan and how he was such a force, Dr. Charles Wright. And I remember hearing him speak so eloquently about this museum that he wanted to build when we were still on the corner of, is it Mac? But wherever that main office is that we call home, the historical Detroit Medical Society office. And now we have this beautiful, internationally known Museum of African American History that is another jewel that will continue forever to carry the legacy of Black history to the world. And he was an obstetrician, gynecologist, and I believe he started practicing. Well, I'm not sure what year he started practicing, but I know he had been honored so many ways, and that the museum grew into what it is now back in 1997 with his small collection, which is now a well established collection in the city.
The initial museum was a series of row houses on West Grand Boulevard and 14th Street. They're still there. And Dr. Wright obtained 4 in a row, broke through the walls, and created the museum with a lot of the help of people within the medical society itself. I hate to tell my age, but I used to ride my bike around that facility wondering what was going on. And later on, as a medical student attending a Detroit Medical Society meeting, Dr. Wright was asking all physicians to give him $1,000 for the building of the museum. And he thought that I was a full-fledged physician. And he said, give me $1,000. He handed me some peanuts. He used to always walk around with peanuts in his hand. And he handed me some peanuts and said, give me $1,000 for the museum. And people responded to him. The $1,000 collected was nowhere near enough money to build the structure that we have now called the Charles H. Wright Museum of African American History. But it was about being part of it, about being part of the gang, part of history also, that actually put something on the map in terms of history in Detroit, history in this country concerning African Americans overall, with excellent exhibits about all phases of life. In addition to that, before World War II, the onset or the Black hospital situation came online because, as lots of places in the South, Black doctors were not granted privileges to white hospitals here in Detroit. So they developed their own Black hospitals. Now, we have a running discussion here in Detroit with people like Dr. Andre Lee, Dr. Moncrief, who are historians, exactly how many Black hospitals did we have in Detroit? And it's somewhere between 21 and 27, depending on who's doing the counting. But here again, that's what Black doctors did out of necessity back in those days in order to get staff privileges. As a matter of fact, University of Michigan's medical school started basically on Wayne State's campus and eventually over time moved to Ann Arbor. But Black doctors in Detroit being denied privileges in white institutions here in the city got privileges at University of Michigan. We found that to be very interesting in the history of Black physicians in the area and their relationship with University of Michigan. And even today, we have relationships that we can build on there or continue to build on there not only from the historical perspective, but also what people actually contribute now. Last count in Ann Arbor, we have about 149 African American full-time faculty. That is a well-kept secret, and a lot of them have connections with African American physicians in the Detroit area. Be that as it may, when the hospital situation got bad, the Detroit Medical Society got involved in terms of the economics of healthcare in the area. And that's when Dr. Lionel Swan, who was a president of the National Medical Association, president at that time in 1965, asked for an audience with President Lyndon Johnson. They would not let African Americans on staff at the medical center downtown, which is a massive structure where you work every day, Dr. Johnson. Now, as a result of that, with him being president and back and forth to Washington, he got the meeting with President Johnson. It was for 5 minutes. And when he went in, the president asked him, "What can I do for you, sir?" And he said, "I only have 5 minutes, so I'm going to stand up and talk." Now, Dr. Swan was about 6'6" and a towering Black man standing over the resolute desk in the White House in the Oval Office, talking to Lyndon Johnson. And the meeting turned out to last over 50 minutes because he said, "Mr. President, your funds through the Hill-Burton Act are building a public hospital, a public center in Detroit, and you will not allow Black physicians well qualified to be on staff." And over 50 minutes later, Lyndon Johnson wrote the letter that said, "Either let African Americans on staff in Detroit or we will hold up the construction money for the project." At the NMA, we have pictures in our archives and on the wall of that actual meeting occurring, and being proud that Dr. Swan was from Detroit, and a family medicine doctor who took care of tons of people around this community. But that reflects on what can be done when we actually take on these challenges and become part of the team that works these to an end to say we can get a better outcome than what we have now. After that, though, we hit the areas of politics in Detroit with people like the president. After that, Lyndon Johnson, a few months later, spoke at the graduation at University of Michigan and talked about the Black healthcare situation in his speech. After that, while he was still in office a couple of years later, he came to the National Medical Association and spoke to the House of Delegates also. So the Detroit impact on this was very, very present in a lot of things that people did, not only locally, but nationally also. The second person that I like to mention is Dr. Alma Rose George. Dr. George was the first African-American female and first female overall to train in general surgery at the Detroit Medical Center. She was a real warrior, one of my mentors, and basically one of the people who blazed the way for a lot of what we see happening in terms of general surgery training to this day in the medical center. Not to mention, she went on to become president of the National Medical Association as well.
Well, I tell you, every time I talk to you, there's new history that I'm learning, and I thank you for exposing us all, because not knowing our history is a problem. If you don't know your history, then you're doomed to repeat it, as it's been said many times, and I see that happening now. So I thank you, Dr. Joe, for reminding me and all of us of how important it is to remember this is not the first time we've encountered struggles. Certainly we have had times in our history from the time Wayne State University opened in 1868 to the present, when there have been challenges. We were first called the Detroit Medical College, and there were 2 Black graduates at that time. The second name, the Michigan College of Medicine, also saw 2 matriculate and graduate. Then the Detroit College of Medicine in 1889 saw 20 graduate. The Detroit College of Medicine and Surgery, 11. Wayne State University in 1935 graduated 43 Black medical graduates, and in 1965, between 1965 and 1974, there were 41 graduates of Wayne State. And this number was the highest in the history of Wayne State University. Those numbers had gone up for a time, but we're seeing, and I'm no longer on the admissions committee, but I believe that the numbers under our new leadership, Dr. Patrice Harold is a part of that leadership, our vice dean, should continue to stabilize with the help of our dean, Dr. Weil Sacker. But it's a challenge. I mean, there are things that they don't have control over, the federal dollars. And so we understand that it is going to be a fight, but it's a fight we can win.
Well, it's always been a fight. I just think it's made up of a series of battles that we go from one to the next. Since you mentioned it, the Wayne State University just recently lost the distinction of training the most Black physicians in the country outside of Howard and Meharry. For many years at Wayne State, we held that distinction until the admissions issues went awry. And I think we just recently, the numbers dipped down, but there is a great deal of progress being made. In 2023, I think we had 22 African-American students admitted to the largest single campus medical school in the country. I think we have 306 in the first year class, and in 23 we admitted 22 students. I think last year in 24 we admitted 53. So we see that there's been a significant amount of progress, and as you said, we hope under the current leadership we can continue that kind of progress going forward. Detroit is still a African American community, having the largest single medical campus in the country, having the medical center as it exists now means that there is a lot of history, but there's also a lot of great opportunity to continue to create history, because that's what we're doing right now. We're creating history. And when we look at it from that standpoint of view, I think it gives us an extra boost of energy to say, how can we improve on a situation that we've had to deal with in the past? But I think you're right. I think we're certainly headed in the right direction. Some of the new leadership it makes you get excited about what we can do in the future as well. The NAACP plays an important role in the history of Detroit and Detroit medicine. The NAACP branch here was always something that African American physicians were part of. As a matter of fact, the largest sit-down dinner in the country, anywhere in the country, is held here every year. As a matter of fact, it's coming up next month here in Detroit. That was started by the Detroit Medical Society when Dr. Lionel Swan was president of the Detroit Medical Society. And that is a major fundraiser nationally for the NAACP. And it has always had a wing, an arm, or a branch connections into healthcare, where we actually were able to cooperate and collaborate with the NAACP to get things done on the healthcare agenda. And they remain today very involved in what we do concerning the politics of healthcare, as well as the outcomes of healthcare. What are we doing that makes a difference in the outcome for people in this community? When we think about that, we can't help but bring up the names of physicians past and some present. Dr. Natalia Tanner, she was one of the people who was admitted to the medical center under the direction of President Johnson, she was a pediatrician, and she went on to become the president of the American Academy of Pediatrics nationally. Her husband, Waldo Kane, who was a outstanding surgeon, was admitted that evening also, and basically operated on so many people around town. He was known all over the place, in the barbershops, at the churches. I mean, he was almost a household name. Um, Sometimes the kids would say, "Is he Waldo in the book?" No, he's not Waldo in the book, but you can relate and reflect. But here again, those were two people who actually made an impact not only on the healthcare of patients, but also in the careers of young doctors coming along like you and myself.
Yeah, yeah. Thank you so much for that. And one of the important initiatives that Dr. Moncrief always says we were the first to do, Dr. Joe, at Wayne State, was the post-baccalaureate program under the leadership of its founder, Dr. Charles Whitten. That was the first such program. There's some debate, but Dr. Moncrief, Dr. Anita Moncrief will always say that that is the first program in the nation. And it was under the leadership of the first African American Dean of Admissions, Dr. Charles Vincent, who was an OBGYN of great renown in our community. Then that propelled Wayne State to becoming one of the top medical schools in the nation, along with, as you said, Howard and Meharry, as well as the University of Illinois College of Medicine, in admitting and matriculating and graduating African American physicians. And as you mentioned, that distinction was held for about 30 years until the early 2000s. And then we saw the federal legislation, the Bakke decision in 1986, Prop 2 in 2006. All of these were legislative initiatives that had an effect on our ability to increase diversity and decrease discrimination in the field of medicine. But as always, we tend to be a resilient people. We tend to be a creative people. And I know that we will continue to work hard to make sure that the initiatives of those who came before us don't stop.
Absolutely. The business of medicine always has a place. And with these kind of people coming along, making these kinds of contributions, one of the first HMOs in the country was started right here in Detroit, and still is in existence today, to a good degree. But it was a model for other programs around the country. And do you remember Dr. William Mays? Dr. Mays was the king of managed care for many years around Detroit, and the way that organization approached the care of African American patients put pressure on other insurance companies to step their game up, in particularly Blue Cross Blue Shield of Michigan, because distinctions were being made in terms of access, some of the same issues we're discussing today, access, quality, outcome, all of those things made a big dent in the discussion concerning the delivery of healthcare in this community, and still to a great degree serves as a model in terms of how we address some of the issues that come up. And as you know, the issues continue to come up, but we have that distinction because a number of plans around the country, including one right there in Washington, D.C., was developed based on the outline, the progress that had been made right here in the city of Detroit, in terms of managed care.
Well, and you mentioned the business model. It made me think of Dr. Marjorie Peebles Myers, who was the first African American female graduate from Wayne State University School of Medicine in 1943, the first African American female resident, chief medical resident, and faculty at Detroit Receiving Hospital, and the chief physician for Ford Motor Company World Headquarters. And that's where that business model comes in. Physicians know no limits to what they can do if they have the mind, the intellect, and the perseverance to carry through on it. So we can think of so many who have been leaders and who have fought. Dr. Charles Vinson was one, and his partner, Dr. Julius Coombs, who you probably spoke about, Dr. Coombs was also a businessman. He and Dr. Vincent had a professional corporation, but he also had the first licensed HMO, as you know, in Michigan.
Yeah, those guys were partners for a long time, and basically brought young OBGYN people in to help them get established and begin the spinoff. As a matter of fact, when we put our group together, former group together, we used their model, which still had a lot of good, sound, basic business principles associated with it. And even though their group was small, our group grew to 27 African American physicians at one point. If it wasn't for the economics making the turn that they did, I think that those numbers probably could double at this point. But when we look at it and we look around the country, we don't find a lot of African American established groups in practice anymore. The advent of the insurance influence in the industry, the inability to keep pace with the finances associated with being in private practice has sent us on in a different direction. As a result, we still have the challenge and the charge to make sure that our community get what it needs. That's why elements like the Detroit Medical Society and all of the NMA chapters around the country are so important when it comes to addressing a lot of these needs. We missed a couple people here in our discussion. You know, we have a great world-renowned cancer center right here at the medical center in Detroit. Very few people know that a African-American oncologist started it. Dr. Clarence Vaughn, who was a Howard product, a colleague of Dr. LaSalle Lafall, started the Cancer Institute here because they gave him, listen at this, they gave him the ability to treat people who didn't have insurance but also had cancer. And that was a mindset back then that, you know, just didn't really exist, to give him that kind of control and to partner with a gentleman who turned out to be his longtime partner, another oncologist, Dr. V at Wayne State, and basically develop what we now have as the Karmanos Cancer Institute. And on his back and his brilliant insight in terms of what we have to do for cancer, became just a top-notch research center, and his contributions to that was over 250 publications that a lot of people just miss in the hustle and bustle of what we do every day. But he was an outstanding guy, and basically nobody could outwork him. We tried, but it never worked out. He was a guy that had the kind of dedication that we need to rekindle in terms of how we actually proceed to achieve outcomes in medicine.
Yeah, thank you for bringing up that name, because I was in residency with his daughter, and I don't know if she told me or someone else, but he used to have hours at 3 a.m., and patients would come.
I was his intern, and for him to give you a 1 a.m., his secretary to give you a 1 a.m. appointment, that was nothing. You know, hassle with her to get an 11 p.m. appointment so that you didn't have to be there too long after midnight. But that's the kind of shop he ran. He had a forte in breast cancer research, and basically I didn't make the connection at the time. I was too new in the industry, but he was the first one to say, we got a problem with tamoxifen. And I'm saying, you know, I didn't understand that only 20 years later for us to find out that tamoxifen not as effective in Black women as it was in white populations being treated for breast cancer. That kind of insight, that kind of intelligence was just outstanding during that day. I used to always wish I was as smart as him, but it never worked out. But here again, we have that kind of history here in the Detroit area, amongst physicians and amongst people in healthcare. Also, we right now we have issues that are going on that kind of make us have to do things in a certain manner to survive. But it does not take away from us the ability to continue to be dedicated to why we all became physicians.
Absolutely, Dr. Joe. I think it's so important to remember how the coalescence of the strength of our individual activities and initiatives brought many of us to this office, this calling of medicine. You had mentioned Dr. Coombs and his group. He had formed the United American Healthcare Corporation, and that formed the National Healthcare Scholars Foundation. And when you look at the National Medical Association and their grant programs, where they are providing grants to students, he provided grants to students at 5 medical schools and nursing schools. And from 1992 until the end of the operations in 2009, the foundation provided grants of more than $1.5 million. If you think of that as one group of individuals, of Black individuals, just think if we as a national group of physicians could do something similar, each of us providing a smaller amount, we could do much toward mitigating the effects of what's happening now. I'm not saying that we could do it all, but we could really help.
Especially with the cost of medical education now, we have this discussion with medical students all the time. We have medical students and residents in our office, and that conversation is going to come up whether you want it to or not, how expensive it is to attain a medical education. And you're right, no one entity can do it all, but that same approach, if you recall, by being in the business of medicine, as physicians in the business of medicine, the foundation that Dr. Coombs created and Dr. Vincent created endowed a chair in OBGYN at Wayne State University, which is funded today through that effort. I don't think that there has been, and I might be wrong, but I would be hard pressed to name another situation that has done that to that degree. And you know what it takes to endow a chair. It's not, just a contribution. It's a real commitment, but here again, that means that they were doing business at a level that allowed them to have availability of those kind of dollars to participate in the educational decision process. I think sometimes that's why we had people who came through Detroit, like Valerie Montgomery Weiss, an OBGYN, who is now the president and CEO of Morehouse School of Medicine in Atlanta. Valerie loves Detroit. As a matter of fact, during her residency and her training here, she came along during the time when that kind of strength coming from the Black physician business community made a major impact in training at the medical center.
I agree. I happen to be part of the House of Delegates when Dr. Valerie Montgomery Rice came to speak as president of Morehouse, and she received a standing ovation because her words were so not only on point, but she was passionate about what she believed could be done. And that passion is hard to not feel, and to feel that we still have opportunities to turn the tide for young people who may be feeling the discouragement of all that they're reading and hearing in podcasts and the news, just to realize that their history is one of resilience, and that we have the abilities to do so many things in so many different disciplines not only in medicine, but as you said, in business, that we can do much to make a difference now for people who feel that they don't have a chance. Because we had chances, and we wouldn't have had them had it not been for people like Dr. Montgomery Rice and Dr. Whitten and all of the ones that we've named, and so many more.
Right. You mentioned Dr. Whitten, who started the post-bac program at Wayne State, national award-winning programs multiple times over for having the ability to take students who normally would not have been given an opportunity or a chance by majority medical schools and produce them in numbers. We have great people nationally who have come through that program in terms of the practice of medicine and also the business of medicine, insurance executives, hospital administrators, all kind of people who have come through that program, all because the attention, the efforts, and the commitment were made to make a difference in terms of outcomes. You know, sometimes I wonder, how can we believe in outcomes-based medicine and not believe in outcomes-based administration or outcomes-based accounting? I think everybody's feet need to be held to the fire in order for us to turn the tide on what we're facing in medicine right now. I also think that we have to make sure that we continue to have these conversations, and archiving this kind of history, such as the COB is doing today, is outstanding, because it will be lost if we don't say it. We have to also embrace the differences that we as a group of physicians have in medicine. My father used to say, if everybody is saying the same thing, that means nobody's thinking. So I think we should be welcoming the differences, keeping in mind that we all have to settle on a path forward in terms to achieve the outcomes that we should have, especially in the practice of medicine and how we take care of a community anywhere in this country. What's good for us is going to be good for everybody in healthcare. There's no way to make that separation.
Absolutely. And you mentioned some of the trailblazers. I don't want to not mention Dr. Joseph Ferguson, who graduated in 1869 from the Detroit Medical College, and he applied and was admitted to the first class. But he along with one of the University of Michigan's heroes, Dr. Fitzbutler, Henry Fitzbutler. He, and I won't take that conversation away from you, but he was born in Virginia in 1821. And you can imagine what life must have been like. And he and his father-in-law were conductors for the Underground Railroad. And they happened to hear Frederick Douglass and John Brown speak at a secret meeting in 1859. And he was one of the signers of the petition for the Detroit Public School Board in 1959 that allowed integration of the Detroit public schools. I said 1859.
Right.
And as a student, he led petition drives, and he did legislate, or at least he was involved in legislation under the Civil Rights Act of 1866, so that schools were forced to integrate. And when he became a physician, he continued that fight for African Americans in the schools, medical school and the other schools in the Detroit area where he practiced.
You know, when we look at this history, we can't help but realize that the people who not only made the sacrifices and the contributions that led to the successes that we had as a medical community or a community at whole, Black doctors in Detroit were civil rights leaders first, and then they were physicians. They were not physicians first. And I think sometimes without that component, we kind of lose the focus on where we should be going, especially when it comes to leadership, because like you said earlier, you know, we can't do everything for everybody, but we certainly can prove that we were headed in the right direction, that we were making progress going down the road. And we've seen that in Detroit. We've seen this happen in almost every phase of medicine, almost every discipline of medicine also, including people who wanted to take alternative paths and not necessarily practice, but people who have gone off into administration and also into the business end of medicine. Also, we've had some great people come through Wayne State and University of Michigan who have definitely made not just a contribution, they've made a difference in this community. And I'm sure that the folks like yourself, Dr. Johnson, coming along are going to continue to do what you do and make even greater differences in the future and greater contributions.
Well, Dr. Joe, as you know, you were the reason why I came to the Detroit Medical Society, because I came to that first meeting and I heard this firebrand and I said, oh my goodness, this must be the next Martin Luther King, because you just, oh my goodness, you just pulled all of us, all the students, into the understanding that it was our responsibility, not only our right and our responsibility to be a part of what is a fight. And it continues to this day. But you taught us that there is hope, and there's always hope for a future that's bright, because we've come through so much. And because of people like you, I can carry on. And hopefully one day people can stand on my shoulders and do something else for the next generation.
Well, thank you. But thank you for all that you do also, because without that kind of leadership and commitment within the walls, we still have a town and gown kind of atmosphere. But we found ways to bridge those gaps and make a difference. We are certainly seeing a lot of improvement coming through the Black physician community that is supporting students. As a matter of fact, SNMA as AMAC is going to be in St. Louis this year, and we're sponsoring, 16, 18 students to go down there. And last year I was at AMAC, I didn't see 2 students from the area. So we said we have to do something about this. So we get to Black physicians and say, this isn't right. What are we going to do? So we're going to have more than 24 students there this year participating, which is something that they need to do, because they are going to be the people who actually sit in the House of Delegates at the National Medical Association for years to come, hopefully, because if we've got to make sure that they are not just present, but that they are getting involved and that they understand. This has been outstanding. I think that we could go on and on, Dr. Morgan, about folks around Detroit and the things that have happened in Detroit. But we want to again thank you and Dr. Renee and your staff for putting this together at the Cobb Institute. It's certainly been a pleasure. And I'd like to again thank my colleague, Dr. Melanie Hannah Johnson, over at the Wayne State Medical School, for joining us. We love you all.
Thank you.
Dr. Morgan.
Thank you both for an exceptional discussion of the history and the importance of Detroit. These are things that, as I mentioned before, I knew because I grew up 4 hours away in Gary, Indiana, in another industrial city, in another city that had the opportunity for me to know, even before I went to college, probably at least 25 or 30 African-American physicians in all specialties. And I had even met an orthopedic surgeon when I was a junior in high school. And I decided I wanted to be an orthopedic surgeon. And lo and behold, I was successful. And so in hearing what you have said, the themes of the importance of involvement in the community and the civil rights, we still have civil rights, being involved, being the spokespersons, being prepared in the business of medicine. I think all 3 of us have had additional training in the business side of medicine and have understood how important that is. To be involved in superior outcomes in terms of medical care. In a challenging environment, I think has been so impressive. And what I'd like to ask each of you before we close, what do you see as the greatest possibility for the new Detroit in terms of the next generation of physicians, and all physicians, not just physicians of color? But what do you see can perhaps be attained now that Detroit has matured to where it is, where we have people in all institutions who are doing great things? What can we expect in the future? Dr. Johnson, Hannah Johnson, sorry.
Thank you, Dr. Morgan. I would say that, I'm very hopeful by nature, and I feel because of what's happening in the city of Detroit, having just heard our Mayor Duggan give his final address about the city, which was full of hope in terms of the businesses coming back to the city. I think because the population is increasing for the first time in generations, that we're going to see that influx of business, that influx of capital, and hopefully we'll also see an increase in the healthcare workforce shortage that we addressed at the Capitol. We would like to see a physician reimbursement improvement so that Medicare can continue to underwrite the graduate medical education efforts, which require the input of federal dollars. And we hope that federal cuts to Medicaid will not occur so that those most vulnerable patients in our population can continue to be cared for. But one thing that's certain, all of us will continue to see those patients who need our care without being subject to restrictions or restraints.
Thank you. Dr. Joe.
I couldn't agree more, Dr. Johnson. I look at the resurgence of Detroit, a Renaissance city now. National Medical Association was held, when I was Speaker of the House, National Medical Association was held here in 2015. We're going to make some noise about bringing it back. However, coming back right now, visitors in the NMA coming to Detroit would not recognize Detroit. Detroit is a different city. It was good then. It is twice as good now in terms of all of the stuff that makes a community go. One of the things that is continuing to happen is our continuous dialogue with industry, with business units, such as the insurance companies, the people who have a stake in having healthy employees come to work, the unions. Those conversations have picked up in terms of what can we do as a group instead of what can doctors do? Because that's, 20 years ago, that was all that mattered to them. What are the doctors going to do? And now there seems to be a turn in the discussion here in the Detroit area because we have a unique mixture. Dr. Randall, we have the poor, the working poor, the middle class. Oakland County right here in Detroit is the fourth richest county in the country. It used to be number 2. It's now the fourth richest county in the country. And if you really want to know what's going on in terms of commerce, look around at the cranes that are building new construction, especially in healthcare construction. It's like they can't wait to put up another building here or there. So we're hopeful that the collective minds can continue to cooperate, continue to work to make a difference across the board. Everything from the care of babies and how we get asthma control rates out of the single digits and how we graduate folks from medical school, get them in, support them while they're there and get them out. All of those kinds of discussions have to be something that the community buys into, not just one particular entity bearing the whole burden of all of the problems that we have. And I see that has happened to a great degree, like Dr. Johnson said, what has happened here. And it's only because of the collaboration that we've had with a lot of these entities around town. And I'm hopeful
Looking forward to all of the things that potentially can happen and making Detroit a model again for a lot of things concerning healthcare.
Well, thank you, Dr. Joe and Dr. Hannah Johnson, for exceptional program and discussion this evening. This is exactly, I think, what both BDO and Cobb Institute had in mind as we have professionals to talk to our communities about the opportunities that still exist and why it's important for us to continue to want to grow. I'm excited about what's happening in Detroit, and I think that this can be a catalyst for discussions about some of our other great cities in the United States, because everyone deserves health care. Everyone deserves access. And I think you have shown the way as to how we can make that happen. So again, thank you both. Thanks to BDO, to our team at Cobb Institute. And we look forward to seeing you next month with another important webinar. Thank you.